Hello everyone, welcome to this session. Now see this picture. Every researcher, or rather the principal investigator, imagines ethics committee in this position, isn't it? So this session is about ethics committee and I'm Dr. Danya. The objective of the session is that at the end of the session we'll be knowing about the various ethics committee, its constitution, composition, responsibilities. There should be at least 7 minimum members in ethics committee. A layperson, at least 1 woman member, 1 legal expert, 1 independent member, either a social scientist, representative of NGO, philosopher, ethicist, or theologian. And of course, we should have clinicians and a basic medical scientist, preferably a pharmacologist. The composition of ethics committee should be multidisciplinary and multisectoral. There should be proper representation of the age and gender. We saw that the minimum number is 7 and it can extend up to 15. We all know too many cooks will spoil the broth, so no more than 15. And 50% should be non-affiliated. Usually, the chairman or the chairperson of the ethics committee would be non-affiliated to the institution. There should be a mix of medical and non-medical members, scientific as well as non-scientific members. Now, what are the different types of review that the ethics committee can do? It can do an expedited review, a fast review involving the chairman or all the members, as in the case of a calamity. Exemption from the review involving only the chairman and the member secretary in maybe research with less than minimal risk or no risk, and full review for majority of the researchers. And what are the types of decision? The ethics committee can approve a research, ask for revisions with minor amendments or major amendments, and reject a proposal. Now, what are the important points in decision making and who makes that? Every person in ethics committee should be involved in decision making. However, a legal expert can specifically look into the insurance policy or various agreements. The social scientist, ethicist, or theologian can provide social, cultural, and religious perspective. Subject expert, if is not present in the amongst the members of ethics committee, could be invited to provide specific information about the disease. The layperson examines the informed consent for the non-technical language use as well as the vernacularity of the consent, and the clinician and the basic scientist looks into the science and ethics. All members are and should be involved in decision-making process. So what is a quorum? For a decision to be valid, at least minimum 5 members should be present in a meeting and they should vote in the meeting. And the quorum should constitute of medical and non-medical, scientific as well as non-scientific members. Minimum 1 member should be a non-affiliated member to the institution, and there should be preferably 1 layperson as a part of the quorum. As I said, without quorum, no decisions are valid. Now coming to the functions and operations of ethics committee. Each ethics committee has its own standard operating procedure, and minimum 5 members should be present to satisfy the quorum. Only participating members can give and advice. We may invite non-members with expertise as subject experts. However, the subject experts as well as the investigators shouldn't participate in decision making. The procedures of ethics committee: the member secretary and chairman is involved in determining the composition of the ethics committee, scheduling, notifying and conducting the meetings of ethics committee, conducting initial, continuing and expedited review. The chairman of the ethics committee is involved in reporting the serious adverse event to the central licensing authority, as well as the member secretary keeps the record. Now, what are the responsibilities of ethics committee? Safeguard the rights, safety and well-being of the participants, obtain the essential documents and examine them, consider the qualification of the investigator. The ethics committee is the gatekeeper for a research, and hence they have to decide whether the investigator is qualified to conduct the research, review the research proposals, timely review the informed consent, and fix the compensation in the case of biomedical research according to the ICMR guidelines, and in the case of a regulated clinical trial, discuss with the central licensing authority agency, as well as in the case of adverse event reporting, get the initial reports from the principal investigator within 24 hours, as well as within the next 14 days, and then within 30 days report to the central licensing agency in case of serious adverse event or death. Now, the Ethics Committee for Biomedical and Health Research deals with non-regulatory studies or trials, and it has to be registered with the Department of Health Research. The initial validity of the registration is for 2 years and it can be extended up to 5 years. The application has to be given in CT1 form and the permission is obtained in CT2. What about Ethics Committee for Regulatory Clinical Trial and the Bioavailability Bioequivalence Studies? It has to be registered with the Central Drug Standard Control Organization, the CDSCO, and the application form has to be submitted in CT1 form and the permission is obtained in CT3. And the registration is valid for a period of 5 years. The compensation for a regulatory clinical trial is fixed based on the guidelines by DCTI, that is the New Drug and Clinical Trial Rules. Now, what is an independent ethics committee? An independent ethics committee is not a part of an institution. However, it has to be constituted in accordance with Rule 7, and it has to be located in the same city or within 50-kilometer radius as that of the clinical trial or the research site. It takes the responsibility of the patient's well-being, rights, and safety. And it is also involved in serious adverse event reporting as mentioned in the previous slide. So, ethics committee, they are the gatekeepers of the research. We should not be afraid, like the initial slide, the principal investigator should not be afraid of the ethics committee because they are to help the researcher. They are to promote ethics. So research involves regulation, ethics, science, economics, agreements, responsibility, collaboration, and hard work. Thank you and have a good day.